We are from group Osteoporosis. My name is Nur Syamila Hidayah and my group mate Siti Nur Syafiqah. Osteoporosis is a systematic skeletal disease categorized by low bone mass and microarchitectural deterioration of bone tissue with a consequent increase in bone fragility and susceptibility to fracture. WHO defined as a bone mineral density value more than 2.5 ft below the mean for normal young white women. Osteoporosis may be invisible and painless, but this silent disease results in fracture, which cause pain, disability, and ultimate loss of independence or premature death. Prevalence and incident globally. Osteoporosis causes more than 8.9 million fractures annually, results in an osteoporotic fracture every 3 seconds. Fracture risk in an Asian population is lower compared to the Western population. The prevalence of osteoporosis is increasing and affects the economic status of the world. 1 in 5 men and 1 in 3 women over age 50 will experience osteoporotic fracture. By 2050, the worldwide incidence of hip fracture in men is projected to increase by 310% and 240% in women, compared rates in 1990. Osteoporosis is estimated to affect 200 million women worldwide. Prevalence of osteoporosis in Malaysia. The prevalence of osteoporosis in Malaysia was reported as 24.1% in 2005, predominantly affecting the hip among the elderly. Overall, 50.3% of the Malaysian Chinese aged above 40 years from Klang Valley, Malaysia has osteoporosis. Clinical feature for osteoporosis. Here is the clinical feature of osteoporosis. Loss of head, short of breath, stupid posture of compression fracture. Back or neck pain, fracture from a fall, weaker grip strength, and also receding gum. Sign in for International Classification of Functioning, ICF. Here is the ICF for osteoporosis. Body function and structure, activity, participation, environmental factor, and also personal factor that relate to each other. Here is the list of ICF that related to osteoporosis according to its domain, which is body function and structure, activity, participation, environmental factors, and also personal factor.
Frame of reference. Frame of reference for osteoporosis are biomechanical frame of reference, rehabilitation frame of reference, and also psychoeducation or educational frame of reference. For biomechanical frame of reference, it considered as a remedial approach that focuses on impairment that affect occupational performance. It also minimizes the deficiencies in the patient occupational performance elements, range of motions, and strength exercise, endurance, splinting, and mobility tasks are all part of the biomechanical frame of reference. Rehabilitation frame of reference. Clients are motivated to concentrate on their remaining abilities and to achieve their maximum level of functions through rehabilitations, reward, and environmental changes. This frame of reference also to increase occupational performance by facilitating them using compensatory techniques such as using assistive device or equipment. Lastly is psychoeducation or educational frame of reference. This is a treatment model in which patients and their families are educated about their disease in order to change their thinking and behavior. It also educating patients regarding their condition on how to practice safety precautions in order to maintain their occupational performance. Next, what is occupational therapy intervention for osteoporosis? Intervention 1 for osteoporosis is aerobic exercise and strengthening exercise. The aim are to strengthening the bone, to improve the muscle strength, to maintain the bone density, to decrease the risk of bone fractures. This intervention is based on biomechanical frame of reference. There are many examples of aerobic exercise. One of it is walking. This activity can be done 50 minutes every day, in the morning or evening, and at least 2 hours per week. Wall press up is one of the examples for strengthening exercise, which is suitable for osteoporosis patients. This is the procedure to do wall press up. Repeat this exercise for 5 to 10 times for 3 sets. For the evidence base, according to Yanis et al. 2014, aerobic exercise is effective in reducing bone loss in the spine and wrist. Moderate exercise is also associated with a 30% decrease in the risk of hip fractures in women when compared with those who do not exercise. Moreover, regular exercise leads to the changes in the bone turnover compatible with decreased bone reabsorption and increased bone formation, based on research done by Agade et al. 2014. Intervention 2 is for psychoeducation. This intervention is based on psychoeducation frame of reference. The purpose is to educate and establish patient awareness toward their conditions, to reduce the tendency of fractures, to maximize independency in ADL and IADLs. The procedure is therapist educates the patient about their condition, which is the risk factor of osteoporosis, and the sign and symptom. Explain the importance of maintained posture, balance, and fall prevention, nutrition, and psychological support. Therapists also can educate the proper and avoidance body posture, such as twisting the trunk and bending forward when doing activities, or doing activities that require to reach for objects. For more detail about body posture, you can refer at National Osteoporosis Foundation website. For the evidence base, according to the National Osteoporosis Foundation 2021, the spine is less stressed when the body is aligned properly, which promotes an excellent posture. Home environment modifications is another intervention for osteoporosis. The aim are to prevent fall, to reduce the tendency of fracture, to maximize independency in ADL and IADL. These interventions using rehabilitation frame of reference. The modification can be done are: remove the rugs or carpet, install nightlight at the walkway, arrange furniture so that it does not obstruct the walkways, install handrails and grab bars in the hallways, shower, and bathroom. Organize the item that used frequently at wrist height, use non-skid mat in the toilet, improve lighting in the house, use a shower chair and the tub bench. For the evidence base, according to Fagan 2016, clients of all ages with health issues, sensory or movement impairments, or cognitive disorder might benefit from home adaptations because they can help them accomplish necessary and preferred daily tasks, as well as improve their safety and well-being. A home modification intervention also can help to lessen the chances of fall or injury, according to Carnemola and Bridge 2019. Lastly is the conclusions. Osteoporosis is a silent illness resulting in fractures that lead to pain, impairment, and ultimately loss of independence or early deaths. Before fractures occur and by evaluating the bone mineral density and with early therapy, osteoporosis can be averted. Osteoporosis leads to a lower quality of life and a shorter disability adjusted life expectancy. This is the references for osteoporosis.
That's all from us.